dear doctors, this is Dr. Azam here, your faculty of anatomy at PrepLadder. And today here we are going to discuss the questions that has been given in your FMG exam, which was conducted on 17 January, that is yesterday. And I hope you have seen already all the questions are extremely easy this time. Thank God, whatever hard work that we have put in for learning anatomy and everything has been paid off. So we have done the main videos. Apart from that, we have also done the rapid revision, as well as we have also done the LRR, last resort revision, as well as at the last moment, just few days before the exam, we have even done the marathon also. And everything, all the hard work has been paid off. So let's get started with the questions right now. Question number 1. Identify the triangle that is shown in the given image. Now, in this given image, actually, this one here will be the anterior belly of digastric. And then again, you'll be finding the anterior belly of digastric on the other side, and there will be hyoid bone. And there will be a triangle formed here. And this triangle is below the mental part of the mandible, and that is referred to as the mental triangle. Mental triangle. So that is actually just below this mental here. So therefore, submental triangle over there. So the answer has to be the submental triangle. Option B will be the right answer here. And we have already discussed this with the anterior triangles of neck. So the anterior triangles of neck are in turn actually divided to like totally 4 triangles, and that is actually the submental triangle. Now moving ahead, identify the marked blood vessel in the given image. One of the easiest question. We have been learning about the coronary arteries many a times. Now in this diagram, this coronary artery will be actually the left coronary artery. And the left coronary artery is going to originate from the left posterior aortic sinus. And we can clearly see the length of this. It is actually shorter and wider in diameter. And remember, it is immediately going to divide into 2 branches. One which is going to take a turn around the heart. That one will be the circumflex artery. And the another one which is going to descend down here, the name of this one will be, yes, it is between the right ventricle and left ventricle. Therefore, this one will be the anterior interventricular artery, which is also referred to as the LAD artery. So here, this one has to be the anterior interventricular artery. So therefore, the correct answer has to be the option C here. Option C will be the interventricular artery. So to be more specific, that is the anterior interventricular artery, and another name of that one will be the LAD artery. Then next, moving on to the next question here. A person came in with difficulty to abduct his left arm above 15 degrees. Now, above 15 degrees, actually, we have learned it is done by deltoid muscle. To be more specific, the lateral fibers of deltoid. Yeah, very good evening. Very good evening, doctors. Yeah, the person actually has the difficulty to abduct his left arm above 15 degrees. Above 15 degrees, abduction is actually done by deltoid, the lateral fibers of deltoid. And there is even loss of sensation over his left lateral arm. Okay. X-ray of the affected arm is given here. Yes, you can clearly see that there is a fracture here. And which structure is most probably affected? All the 3 points which are given in the question here, we have actually discussed. Okay. Now, first of all, this image which is given here, that is nothing but the fracture at the surgical neck of the humerus where axillary nerve will be involved. And if axillary nerve is involved, deltoid is gone. So there'll be like loss of abduction above 15 degrees. And then if axillary nerve is gone, there will be loss of sensation over the upper lateral side of the arm, which is referred to as regimental back sign. So every point we have discussed here, of course, the answer here should be the axillary nerve. Now, once this question is discussed here, someone is writing here. Sir came from anesthesia. There was an anterior specified option previous question. पता नहीं क्या बोल रहे हो आप लोग. Next one. Match the corresponding structures according to the labels in the given image. You mean to say questions came from anesthesia? क्या बोल रहे हो? Now, match the corresponding structures according to the labels in the given image. Now, in this image, it's very simple again. Option A here, this one will be the clavicle. And you can see in all the options, A is given there as the clavicle. And then after that, B here is actually the coracoid process there. The B will be the coracoid process there. Fine. And then after that, C here will be obviously the scapula. It has to be the scapula there. And finally, D here will be the acromion process. So therefore, the correct option here will be the option B. It's like another easiest one. Anesthesia recall just ended. Acha, acha, okay. You mean to say you came from the recall of anesthesia. Fine. So in this question, they didn't ask about the bone name, but the joint names. Okay, fine. So it was not about the bones, it was actually the joint names. Aortic knuckle था सर ऑप्शन में. कौन से वाले ऑप्शन में aortic knuckle था? Aortic knuckle वाला कौन सा है भाई? Okay, let's go towards the next one. Which of the following muscle is not innervated by the nerve shown in the image? Yes, the students who have answered me, like who told me that the recall questions were given. Actually, in the image, the nerve which was given there was about the ansa cervicalis. Okay. They have given the joint names like acromioclavicular and all. C and D is a joint name. Okay, I got it. So which of the following muscle is not innervated with the nerve shown here? Actually, in the given image, it was about the ansa cervicalis. Ansa means the loop, cervicalis in the neck, and there'll be a loop-like structure in the neck here, ansa cervicalis. And that will be supplied to sternothyroid, sternohyoid, and the omohyoid. So ansa cervicalis here will be supplying to sternothyroid, sternohyoid, and then omohyoid, but not the thyrohyoid. Thyrohyoid and the geniohyoid, they'll be actually supplied by, yes, of course, C1, but via the 12th nerve. We have studied about that one. They are supplied by C1, but via the hypoglossal nerve. Is it okay? चलिए अब हम बढ़ते हैं आगे. Let's go ahead right now. Identify the mark structure. Section of the brain. Yes, of course, you have to learn all the three sections of the brain. ये मैं आपको कई बार कहता हूँ. I told you like many times. Out of the three section, definitely in the exam they'll be giving like one section, and in that section you should be able to identify all the structures. And this is one of the easiest one. That is your corpus callosum here. So option A will be the right answer here. Now moving on to the next one, a 60-year traffic police presented with dull pain in both the lower limb with tortuous vein as shown in the image. Which of the following structure is involved in this one? Obviously, it is actually representing about the varicose vein, and the vein which is involved here will be the great saphenous vein. The great saphenous vein will be involved in this one. Now, identify the mark structure in the given image. In the given image, we are actually learning about the development of tongue. We are learning about development of the tongue. And in the development of the tongue, this one here will be the lingual swellings, which are formed here in the first arch, lingual swellings over there. In between them, this swelling here will be the tuberculum impar. And this one here will be the hypobranchial eminence. इसको हम कहते हैं hypobranchial eminence. So there will be two lingual swellings. In the middle, you'll be able to appreciate the tuberculum impar. और फिर होता है hypobranchial eminence. बेसिकली ये हाइपोब्रैंकियल एमिनेंस फिर से दो पार्ट्स में डिवाइड हो जाता है. एक होता है क्रेनियल पार्ट, वन विल बी द क्रेनियल पार्ट, अनदर वन विल बी द कॉर्डल पार्ट. Another one is a caudal part. Now, what is going to happen? This lingual swellings and this tuberculum impar, all of them will combine together to form anterior tooth of the tongue. Whereas the cranial part of the hypobranchial eminence will be forming the posterior one-third of the tongue. And then the caudal part of the hypobranchial eminence, it is the one which is going to form the posterior most part of the tongue along with the epiglottis. So please remember that these swellings here will be the lingual swellings. So in the exam, they have just asked the name of these swellings here. Of course, those will be the lingual swellings. Now, once this is done here, another very, another important question. And if you people remember, when I taught you about either RR or LRR or in marathon also, I told you very clearly about the mandibular nerve. And I said I was shouting like anything there. Okay, mandibular nerve will be dividing into two divisions. One is your anterior division, another one is posterior division. And I said you that posterior division will be giving rise to Ali branches. अगर आपको याद होगा, almost in every session I was telling you, mandibular nerve will give rise to Ali branches. और मैंने कहा था आपको कि ये तीनों branches से आपके एग्जाम में सवाल आएगा. Definitely the question will come from out of these three branches. Every time they'll be giving one branch. And in fact, auriculotemporal nerve, lingual nerve, and inferior alveolar, all the three nerves, I even told you the question that is gonna come. जो सवाल आएगा मैंने आपको वो भी बताया था कि यहाँ पर मैंडिबुलर नर्व में इंफीरियर एल्वुलर नर्व में इंफीरियर एल्वुलर नर्व कहाँ से पास होगी, यही सवाल आता है. मैंने आपको कहा था कि इन दिस मैंडिबल ऑन द मीडियल साइड देयर विल बी वन ओपनिंग, एंड दैट ओपनिंग विल बी द मैंडिबुलर फोरामेन, And yes, of course, via the mandibular foramen, inferior alveolar nerve. In that early branches I, inferior alveolar nerve will be actually passing from here. Fine. So the correct answer here will be inferior alveolar nerve along with the inferior alveolar vessels. They ask like which nerve will be blocked when anesthetized at the arrow mark, something like this type was given. Okay, okay. Nerve block. In this question, you mean to say, doctor? Nerve block. Okay, when anesthetized. Okay, fine. Will actually correct it off. The next, which ligament is injured in the shown given image here? Of course, the moment you look at this diagram here, that ligament is actually crossing there. If it is crossing, it has to be the cruciate ligament. And in this diagram, the one which you are able to see here will be the anterior cruciate ligament. Fine. Okay. There was a facial nerve mark. Okay. ठीक है. That means I have to actually redo that question. Let me see like what are the other possibilities that I get from the students. Yeah, you can also just drop me the message. Like what was the exact wordings and what are the options regarding that one. Fine. Now this one here will be the anterior cruciate ligament. No doubt about that one. I said it was tragal pointer. Kabaddi player. Acha, in this one. Fine, fine, fine. Okay. Fine. We're actually not looking for the exact wordings, but अपने को यहाँ पे ना concept पता चलना चाहिए कि the students who are going to prepare the exam further, they should get an idea from where the questions are being asked. Tragal pointer. Okay. इस सवाल में दिया गया होगा ना tragal pointer तो. Mm-hmm. Now this is the easiest one here. Identify the muscle along with its action. Hand muscles of hand we have learned like many times. There are totally like 20 muscles of hand. Out of that 20 muscles of hand, between the bones here, between the metacarpals will be interosseae. और मैंने आपको बताया था जब कभी भी बोन्स के बीच में यहाँ पर मसल दिया जाएगा इंटरॉशियाई होगा. और अगर ये यूनिपिनेट होगा तो ऑब्वियसली इट विल बी पामा इंटरॉशियाई. एंड इफ इट इज बाइपिनेट ऑब्वियसली दैट विल बी डॉर्सल इंटरॉशियाई. तो आप देख सकते हो ये वाला डॉर्सल इंटरॉशियाई होगा. And dorsal interosseae, yes, I hope you remember that mnemonic pad and dab. So dorsal interosseae will be helping in abduction. So therefore the correct answer here will be option C. Dorsal interosseae will be helping in abduction. No, 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 Dr. Sajjad, don't worry about that one. Be positive. Always like whatever you think or whatever you manifest has to be positive. तो गोइंग टू प्रिपेयर वालों में हम भी हो सकते हैं. ऐसा मत कहिए. नेवर से नेगेटिव थिंग्स. बी पॉजिटिव. जो आपने किया यू हैव डन बेस्ट वट एवर यू कुड हैव डन. जो होना था वो हो गया है. बाइकॉन इज बाइकॉन. टाइम इज गॉन. एग्जाम पेपर में तो हम कुछ चेंज नहीं कर सकते हैं बट जस्ट लेट्स प्रे दैट एवरीथिंग विल हैपन राइट नाउ. ओके. तो जस्ट बी पॉजिटिव. डोंट वरी अबाउट दैट वन. जो आपने किया वो बेस्ट किया आपने. यू हैव डन योर बेस्ट देयर. अच्छा दैट्स अ डिफरेंट क्वेश्चन. ट्रेगल पॉइंट वाला डिफरेंट क्वेश्चन है. ओके जी, मैंने नोट कर लिया. फेशियल नर्व आइडेंटिफिकेशन ट्रेगल पॉइंटर कह रहे हो तो वो भी तो टॉपिक हमने किया ही था ऑलरेडी. दिस इज एक्चुअली सेपरेट क्वेश्चन. फाइन. ओके ओके फाइन. A constriction was encountered at the 40th centimeter from the incisors during endoscopy session. Which among the following causes the constriction? Constrictions of esophagus, we have revised in thorax topic, and I told you that will be at 15 centimeter, 23, 28, and 40. So in esophagus, you'll be having like 4 constriction at 40 centimeter when it will be crossing the diaphragm. So therefore, that will be, yes, when esophagus is going through the diaphragm. Sir, you are the best. I have only done anatomy from your videos and can solve most of the questions. Thank you, thank you, thank you, Dr. Zubair. बट द मार्कर वॉज ऑन द डायगेस्ट्रिक मसल. यार ये ओल्ड क्वेश्चन है, हमने कई बार किया है ये. आइडेंटिफाइंग दैट वन या इट वॉज बिलो द फेशियल. ठीक है. Now finally one more question here. Identify the muscles given in the image and this is about the posterior abdominal wall. सो इन द पोस्टीरियर abdominal wall मैंने आपको बताया था ये वाला होगा psoas major muscle और ये वाला होगा psoas minor muscle. And then this rectangle shaped muscle or quadrangular shaped muscle will be nothing but quadratus. And it is actually in the lumbar region. That is the reason why it is referred to as lumborum. And this muscle, which is going transversely here, that is transversus abdominis muscle. So option A here will be the psoas major. Option B here will be the psoas minor. And option C here will be the transversus abdominis. And option D will be quadratus lumborum. So here, correct answer will be option B here, sir. Thank you. Thank you, Dr. Rishabh. Yes, the concepts are like crystal clear. We have made all the concepts very much clear. It was below the facial nerve. Next. Okay, there was either name used for diaphragm. There was another name used for diaphragm. Thoraco-abdominal diaphragm ही होगा और क्या हो सकता है? Actually, in our body, Dr. Shahid, Dr. Shahid, I think in our body we are actually having different diaphragms. It is not like only one diaphragm that we have. We have learned in the pelvic and perineum topic that we do have urogenital diaphragm, we do have pelvic diaphragm. तो इस तरीके से oral diaphragm भी होता है. तो हो सकता है उसने completely आपको नाम बताया होगा कि yes, thoraco-abdominal diaphragm, something like that. Okay. Thank you all. And by this, we have revised like almost all the questions over here. If any other questions are left, let me know. You can drop me a message in my Instagram channel. And diaphragmatic pinch was written. Acha, okay. Thoracic diaphragm, this one, sir. Yeah, thoraco-abdominal या फिर thoracic diaphragm. Acha. They mention esophageal tracheal junction. Okay, fine. There was a question regarding Wernicke and Broca's speech area also. Okay, fine. So let me check into this one here. Broca's and Wernicke also there was a question. Fine. Doctor, we are going to give the FMG exam in 2028. So now we are learning anatomy from you. All the best, all the best. God bless you. God bless you. You will surely succeed. And I think you have started at the right time. 2028, you are left out still with like, approximately 2 years of time and you can do all your 19 subjects perfectly. So please concentrate on the concepts till that time. And of course, sure, I'll be there. I'll be helping you always with all the updates and everything. So keep following the concepts. Please focus on the concepts. Don't go for the shortcuts right now. You have enough time left out. So please don't go for the shortcuts and all. Concentrate on the concepts and build your concepts very nicely. You are seeing the exam nowadays. It's not about mugging up the PYQs only or simply solving certain MCQs and all. It's all about like concepts. If your foundation is like rock solid, you'll be surely able to clear the exam in the first attempt. God bless you. I'll pray for you. Yes, sir. Wernicke was there. There was a question on Wernicke. Okay, Dr. Rishabh. Okay, Dr. Hamza. I'll take care about that. Ulnar nerve question was also there. Oh my God. Ulnar nerve question was also there. What is present at 40 centimeters from the incisors? I hope you know we have learned about the topic of constrictions in esophagus. अच्छा, the patient was able to speak but speaking incompressible. Okay, ठीक है मैं देखता हूँ कौन सा वाला सवाल आया था. Yes, they said the patient spoke fluently but we couldn't understand in the Wernicke. अच्छा ठीक है जी. ओके सर मैंने अभी रिजॉल्व 2026 वाला प्लान लाइव ज्वाइन किया तो चलेगा क्या? नाउ आई एम इन द 4th year ऐप पे. ऑफ कोर्स इन द रिजॉल्व it's going to be like much more good. Why? Because we'll be live and you can interact like this exactly as we're interacting right now. So then in there all your doubts will be clarified and everything will be done. चलिए सर, सुप्राकॉन्डाइलर फ्रैक्चर भी दिया गया था. ओके ओके, दैट्स रियली नाइस. ये भी हमने डिस्कस किया था. So this time actually anatomy was like supracondylar fracture. Fine. Yeah, this time anatomy was like, they have given the questions in such a way that they want you to score actually. कि भैया स्कोर कर लो अच्छे से. सुपीरियर टेम्परेचर ठीक है फाइन. So let's wind up here. ये हमारी बातों का सिलसिला तो ना चलता रहेगा. So better you people do one thing. If you have any suggestions, if you have any questions in your mind, so please drop me directly. You can drop me a message on my Instagram handle. I'll take care about that one. I'll include all the questions, and as soon as possible, I'll let you know the exact questions which were asked in the exam. Liked anatomy because of you, sir. Thank you, thank you, thank you, Dr. Mohan. Sir, in the prep new version, how many time prep will revise the subject? I did not understand your question, but if you're asking me how many times we'll revise, at prep we'll be doing the main videos. Apart from that, we will be doing the rapid revision. We have been doing LRR, as well as nowadays we're also doing the marathon also. So they're like almost 4 or 5 times. We ourselves are revising the syllabus as much as possible. I think that is the best we can do for you. Yeah, posterior dislocation of femur was also given. Fine, I'll take care about that one. Chalo, by this, we'll end this session here. Thank you. All the best and enjoy your life till now. And this time will be the best time after the exam until your results. So until your results, you just relax and chill and enjoy your life. And then after the results, there'll be another story that is going to begin. I'll be praying for all of you. Inshallah, you'll be passing the exam. And then after that, you have your documentation to be done, your internship to be done. So there are a hell lot of works to be done in the life. So right now, just chill and enjoy your life. Okay, na? Thank you. God bless you all. Take care. Be happy. Thank you.